Hi guys, this is Dr. Chloe Costigan from Mobility Doc. So in this week of Mobility Doc Does Yoga, for the core series for week 2, we're going to focus on side plank. So for the triplet, we're going to first start with doing a supine figure 4 stretch. Then you're going to do side leg lifts on each side. Finally, you're going to move into side plank hip lifts. You're going to repeat the triplet a total of 3 times. For the strengthening portion, we're going to highlight that side plank position. Let's take a look at the 3 exercises for the triplet. The supine figure 4 stretch is a great stretch for improving the flexibility through that glute. It's imperative for any type of lower body activity, including running, cycling, jumping, squatting, things like that. So let's get started. For my starting position, I'm starting by lying down on my back. Now, here is what is so important. If I'm stretching this glute area, I can get the stretch by moving my thigh bone as well as moving my pelvis. So let's first focus on this pelvis position. So when I'm lying down on my back, I have a slight arch in my back. I'm not tucking and rounding like this, okay? So I have a slight arch in my back. Then cross your left leg over your right. So then as soon as you go to cross this, you can feel that that back is going to kind of round. I'm just going to reset. Now, this might be enough just being able to be in this position. You know, you can kind of focus on pushing that knee away. But ideally, what I want you to do is you're going to interlace your hands behind the back of your right leg. Now, immediately as I do this, I can feel my back once around. As much as I can, I'm going to try to create an arch in my back and then try to pull this right thigh forward, like in toward my chest. I'm also using my left arm to kind of block that leg a little bit to make sure that it isn't kind of coming in toward me too much. So I'm kind of like hooking this arm around and pulling in. And then as I pull in, I need to make sure, okay, I'm gonna get a little bit more of an arch in my back as I pull back. That is the prerequisite though, is you really need to, I don't want you kind of rounding up like this. I really want you to try to stay in a neutral position in your back and create like a little bit of an arch in your back. Side leg lifts are a great exercise for making sure that you can activate that glute med muscle. The glute med is so important for stabilizing your hip. So it makes sure that the other side of your pelvis doesn't drop down. Now, in order to be able to apply that activation into a functional activity, we need to first make sure that we can isolate that muscle. So you're going to start by lying down on your side. So I'm focusing on activating this top hip. It's like kind of right at the top part of my pelvis. This is where that glute med muscle is. So I'm gonna bend the bottom knee just to help me to stabilize. Now, when I go to set up, I'm trying to make sure that from my heel to my head, I'm in one line. Now, as I go to lift my leg up and down, I'm making sure that my heel is staying behind where my hip is. Most times people want to lift their leg up like this, then you're just using your hip flexor. The other thing that I'm focusing on making sure that I'm doing is leading with my heel, because people tend to bring their toes up and lift up like this. So as I'm going to lift up and down, I'm making sure that I'm getting this motion of just this thigh bone is moving up and coming back down. I'm also trying to not move my spine too much as I do this. So just back and forth. Side plank hip lifts are a great exercise for improving core stability and hip stability. So this can be used as a progression to something like side leg lifts. So let's get started. You're going to come in this side plank position. The setup is very important. So from my left elbow to my shoulder, all the way down to my heels and in between with my pelvis, I'm setting up as one line. What's going to happen is I'm going to want to kind of like bring these legs forward, bring this forward, so now I'm in kind of this pike position. But as much as you can, you're trying to stay in one line. Now, in order to lift up my pelvis, I need to make sure that I can activate my abdominal muscles as well as some of the muscles in the side of the hip. So it's imperative that I press my forearm down as much as I can, so then I'm not kind of sinking into my shoulder, and I press to the outer edge of my foot. So I'm going to press simultaneously as I think about lifting this up. So then I'm going to come up and then down, up and down. So you see how this motion is coming from, I'm in this side bend position on this side of my hip, and then I'm in a neutral position, back and forth, just like that. So for the triplet, we're going to first start with doing a supine figure 4 stretch. You're gonna hold that for 30 seconds. Then you're gonna do 10 side leg lifts on each side. Then finally, you're going to move into side plank hip lifts. You're going to do 10 on each side. You're going to repeat the triplet a total of 3 times. Now that you're done with the triplet, you're going to move on to side planks. Side planks are helpful for improving single side core and hip stability, and even a little bit of shoulder stability as well. So it can help to highlight if there's some type of asymmetry side to side. So to get started, I'll first show you on my forearm, and then I'll show in a push-up plank position. So I'm gonna be lined up from one line from my heels to my pelvis to my arm. So this, I need to maintain this line. So my pelvis isn't rolling forward, it's not rolling back. Now, in order to get this lift to be able to hold, I need to make sure I press through my forearm, press through the outer edge of my foot to lift my pelvis up. If you're not as familiar with this, try doing the side plank hip lifts. You can really make sure that you have that good positioning. So I'm pressing through the outer edge of my foot and through my forearm. Your shin might be kind of on the ground, but you kind of want to lift that up. So I'm pressing and then I'm going to hold. So I like to place my hand on the top part of my pelvis as a little bit of a guide of okay, if I'm turning open or something like that, okay? Now, a variation would be with my hands straight. Now, this is going to kind of change a little bit of this, and it's going to really make sure that you are that you're putting the shoulder in a good position when you do this. So when I'm here, when I come to lift up, I really need to focus on making sure that I'm pressing through this hand as much as I can, that I'm not letting my shoulder come up toward my ear. You're going to hold for 30 seconds on each side. Do that a total of 4 times. Make sure to like and subscribe to the Mobility Doc YouTube and share with your friends, and let us know what you think.